Welcome to our webinar, Reopening Your Practice in the Wake of COVID-19, Risk Management Considerations for Play Therapists. Legal disclaimer. This information is provided as a risk management resource and is not legal advice or an individualized personal consultation. At the time this resource was prepared on June 9th, 2020, all information was as current and accurate as possible. However, regulations, laws, or prevailing professional practice standards may have changed since the posting or recording of this resource. Accordingly, it's your responsibility to confirm whether regulatory or legal issues that are relevant to you have since been updated and/or to consult with your professional advisors or legal counsel for timely guidance specific to your situation. As with all professional use of material, please explicitly cite TRMS Inc. as the source if you reproduce or distribute any portion of these resources. Reproduction or distribution of this resource without the express written permission of TRMS Inc. is strictly prohibited. Some information about my background. I am the Healthcare Practice and Risk Management Innovation Officer at Trust Risk Management Services Inc., or TRMS. TRMS is the APT-endorsed professional liability insurance program. I focus on developing a wide range of risk management content for allied healthcare professionals across the country. I have practiced as a defense attorney in a Boston law firm and began my career as a clinical social worker, including as a play therapist, in a variety of inpatient and outpatient settings. I obtained my JD from the Massachusetts School of Law, Masters of Social Work from Springfield College, and Bachelor of Arts from the University of Massachusetts. I am a member of the bars of Massachusetts and Connecticut and the District Court of Massachusetts, a clinical social worker in Massachusetts, and a fellow of the American Society of Healthcare Risk Management. Some information about our company. TRMS is the APT-endorsed professional liability insurance program offering professional liability, student liability, business office, directors and officers, and other insurances to play therapists and allied healthcare professionals in more than 120 professional classes. TRMS also manages insurance programs for allied healthcare associations, providing insurances to association members working in private practice and employed settings for individual policies and policies for groups. TRMS is licensed in all 50 states and the District of Columbia. TRMS has a strong commitment to provide superior service and products to our policyholders, including play therapists. Now let's get started. The coronavirus or COVID-19 pandemic has certainly impacted all of us, and this includes play therapists. There are significant differences in how each practice may be operating depending on the location. Most states implemented emergency orders, such as stay-at-home orders, whereas some have not. Some states have implemented orders allowing only businesses deemed essential to be open, and the definition of essential may vary widely depending on the state. There is a state-by-state compilation of emergency orders which can be accessed online and may be of use as you navigate through these rapidly evolving regulation changes. Changing practice. Telehealth has emerged and has grown considerably. Following the coronavirus outbreak, one company reported that their platform experienced an increase of services of 312% in New York and 700% in Washington state alone. I'll talk a bit more about telehealth later in the program. We are now faced with some states reopening and possibly reopening portions of a state by region that do not have a large number of cases compared to other areas. It varies considerably. The Centers for Disease Control and Prevention, or CDC, and the federal government have issued reopening guidelines. It's important to note that these are guidelines or recommendations, and states can determine whether they choose to follow them or not. From a risk management standpoint, play therapists should follow current CDC guidelines, applicable state and federal regulations, and I want to note that these may differ, and it's important to follow the stricter of the rules. Also, check the APT website for a lot of COVID-19 specific resources available. Also, for those of you who work for a hospital or clinic, know what their policies and procedures are, as they may have changed. So you're able to reopen in your state or the region within your state, but should you? The health and safety of your patients, your staff, and you are of the utmost importance. Prior to reopening or transitioning to reopen, many factors should be considered, and your practice may need to undergo considerable changes to implement safety measures to reduce risk. Let's get into some specifics. Some risk considerations include, when thinking of reopening your practice, consider if you're comfortable doing so. It's important to determine your risk and the risk of your patients. Be aware if you're in a high-risk category. Consider your own health and the health of your patients. Determine if you want to have reduced hours or maintain some hours via telehealth. Are you going to have part-time hours or open your office full-time? You will likely need to develop new or will need to revise policies and procedures for your office. These may vary depending on your office location and specifics, but in general, some of these may include use of PPE. This could include use of masks, gowns, or face shields, revised or new infection control procedures, social distancing guidelines. Do patients need to be 6 feet away from one another? How about staff? Are they distant from one another in the office? How many individuals can be in the office at the same time, including patients and staff, and how will this be managed or monitored? Waiting area requirements or patient check-in process, and this likely will be specific to your office. Let's talk about pre-screening patients before they come into your office. As we have all heard, there are individuals who can be asymptomatic but have the virus. To minimize risk of exposure, it's important to conduct a pre-screening prior to the patient and or his or her parent or guardian coming into the office. If the patient is a minor, ensure that this pre-screening is done with the adult with legal authority. These issues include items such as temperature check, questions about travel to certain high-risk areas, contact with someone known to have had COVID-19, and whether the person has been under quarantine and when. If your patient does not have a thermometer at home and cannot take his or her own temperature prior to arrival, consider doing so prior to entry into the office. Keep in mind, however, your comfort level, your staff, and your staff's safety. If you do not feel comfortable with someone coming into the office and are concerned of risk, consider not allowing him or her to come in for an in-person visit. If age and developmentally appropriate, remind the patient and or his or her accompanying parent or adult not to come into the office if he or she or his or her parent has a fever, shortness of breath, coughing, gastrointestinal issues, or other symptoms associated with COVID-19. Ask the accompanying parent or adult to take his or her temperature and the temperature of the patient prior to leaving the house for the scheduled appointment, and indicate that he or she will need to reschedule the appointment if experiencing any symptoms or have had potential exposure. When the patient comes into the office, go through all of the screening questions again with a parent or accompanying adult. Have him or her sign a document that acknowledges that he or she does not have any of the symptoms. Most often your patients are going to be minors. If so, make sure whoever is accompanying them has the legal authority to sign the document, and make sure the person is screened as well as the patient. With respect to temperature checks, check your state website and the CDC for updated guidelines on the type of thermometer to use, such as forehead or oral. Make sure that you have a process in place to properly disinfect in between each patient. Again, if the patient is accompanied by another person, he or she should be screened as well. Follow guidelines on whether your office should consider taking the patient's temperature when he or she arrives for this inpatient appointment. Ensure that the person signing the documents, again, has the legal authority to do so on behalf of the patient. And I'm going to talk about informed consent a little bit more in a short while. All of these steps, pre-screening and screening steps, should be taken with both existing and new patients. With respect to new patients, however, you're going to want to review your new patient forms to determine if they will need to be updated. Staff training. Prior to reopening your office, it's important to meet with all staff regarding changes in policies and procedures. Consider holding a video conference with staff prior to reopening your office. Staff may be nervous. They may have questions, and they may also have helpful ideas and strategies. Some issues may include use of PPE, new patient pre-screening and screening process, the check-in process, cleaning of equipment such as toys, handling and cleaning of devices, and a policy of how employees can notify the office if they are ill. In an effort to keep you, your staff, patients, and families safe during this time, consider screening staff each workday. When your staff members arrive for work each day and prior to patients arriving, consider screening them for symptoms, travel, contacts pertaining to COVID-19. If the staff member has had exposure, follow recommendations as set forth by the CDC. Staff should be aware how to notify the office if they are ill. If you have questions about whether to continue paying staff or how to handle employment-related issues, it's important to contact an employment attorney, and also that you are aware of regulations regarding payment for those ill or suspected of having COVID-19. Develop a log of your tracking. Office practices related to personal protective equipment, or PPE. Depending on your practice and current guidelines, it's important to determine if PPE may be indicated. The Occupational Safety and Health Administration, or OSHA, has issued guidance which we suggest you review and follow. Develop an infectious disease preparedness and response plan. Again, consult the OSHA guide to incorporate, and this can be found on pages 7 and 8. Implement a routine cleaning policy. Ensure your office implements procedures to reduce the risk of spread on surfaces. Review and follow OSHA's 10 steps all workplaces can take to reduce the risk of exposure to coronavirus. The Environmental Protection Agency, or EPA, has a list of cleaning products effective against COVID-19. Determine how the office will be sanitized in between patients, for example. Ensure these procedures are followed routinely and that your staff is aware of the process. Avoid patient-to-patient contact. When possible, implement separate entrances, limit how many persons can be in the practice at a time, and request that patients do not enter the office until the time of their appointment. When able, consider asking patients to wait in their car until the time of their appointment. Determine if your office needs to be rearranged. If you have a waiting room, determine if chairs need to be rearranged to maintain safe distance. Remove any items such as magazines, books, or toys that can increase the risk of spread. Ensure that you use toys that can be wiped down if you're using them with patients or if they happen to be in your waiting area. They should be wiped down in between each patient use. Know who is responsible for doing this. Is it a member of your staff, or are you responsible for it? Additionally, talk with other colleagues about whether plexiglass partitions may be indicated in your check-in area. Alter payment procedures. Avoid taking cash payments when possible. When taking a credit or debit card payment, staff should wear gloves or use hand sanitizer when handling. Sanitize the card when returning to the patient. Reporting. Ensure that your office knows how to report a potential COVID-19 case or exposure to your office. Know how to contact relevant public health officials if you suspect a patient or staff member may have COVID-19, or notified that a patient or staff member was in your office and has been diagnosed with the virus, and or there was exposure to your office. The CDC encourages businesses to coordinate with state and federal health officials so timely and accurate information can guide appropriate responses. The website provides links to state resources. Before you open your office, send a letter to all of your patients, and with respect to minors, to their parent and or legal guardian. Develop and mail a letter to patients, all of your patients. Again, if they have a parent or guardian, send the letter to them. This letter should outline items such as changes in your practice, safety precautions that the office is taking, an explanation that the office will be implementing a phone pre-screening for each scheduled appointment, and new policy for check-in, waiting area changes, and screening. When patients arrive to the office, we suggest that you have an acknowledgement document for them to sign, and with minors, ensure that this is signed by their parent or legal guardian, indicating that they reviewed the letter. If they indicate that they did not receive the letter in the mail, present them with another copy along with the acknowledgement document, and document this in the patient's medical record. Update your website. Post an announcement on your website, including office hours, information regarding telehealth, and the letter to all of your patients. Post announcements or notices on the door and in the office. Post any announcements about wearing a mask, the use of hand sanitizer upon entry, or asking patients to wait to come into the office until their scheduled appointment. The notices on the door should indicate the patients should not enter the office until the notices have been read. Make sure that these notices comply with local rules and regulations. For example, some local cities require a mask, whereas others do not. If regulations require a mask to enter the office, patients should be notified that they will not be allowed entry, will not be seen without a mask, and their appointments will need to be rescheduled. It is important to ensure that the notices have large enough font which will draw attention to them. Consider prioritizing patients. Your office may have been closed for a period of time, and you may need to do this. Some may have been waiting, again, for a considerable period of time and may need in-person appointments more so than others. It's important to consider prioritizing based on the need. Know your responsibilities under the Americans with Disabilities Act, or the ADA. Be mindful of your obligations and whether you need to make reasonable accommodations for a patient. A few to mention include the use of auxiliary aids and interpreters. To ensure effective communication, you may need to use auxiliary aids to facilitate communication. The ADA defines auxiliary aids, and examples include video remote interpreting services, or VRI, qualified interpreters, assistive listening devices, note takers, written materials, braille materials, etc. Auxiliary aids should be accessible, timely, protect privacy and independence. Given the current environment, you may not be able to access in-person interpreter services. Avoid using family members or friends accompanying the patient. Consider consulting with an attorney or risk management professional to determine the permissible auxiliary services. Another important consideration I want to mention has to do with reporting obligations. We could easily spend an hour or more on issues surrounding child abuse and neglect, but I would be remiss if we didn't touch on this very important issue when talking about reopening your practice. You may not have seen your patient in person for an extended period of time. The children you see for treatment may have been confined within their home if they were in a state where there were stay-at-home orders. They likely have also been out of school and isolated from others. Children may not have been safe, and they may have been at increased risk. They also may have been subject to witnessed domestic violence or child abuse, much more so than previously. Some of these children may live with an abuser. Individuals who have substance use issues are also at increased risk of use or relapse due to environmental factors. Add to this financial stress such as parental job loss and/or lack of food, isolation, and limited in-person resources due to programs being closed in the wake of social distancing rules. I want to note that many of you may have been providing telehealth sessions to your patients post-COVID-19. There may be challenges to assessing for abuse and neglect or risk of harm, given that the patient may have only been seen on a screen, or even more challenging, observing via the phone for a telehealth session. It's important, however, whether in person, on a screen, or on the phone, that you remain vigilant for signs that the patient may be experiencing abuse and neglect or risk of harm, and report to relevant authorities, including the police, when indicated. Each state has differing rules on mandated reporting of suspected child abuse, what allied healthcare professionals or play therapists are required to report, and whether there are penalties for failing to report. All states require that allied healthcare professionals are required to report suspected child abuse. However, be aware of variations, as some states may require providers to report abuse that occurred years earlier but was not disclosed until the alleged abused child is an adult. Be aware of change in demeanor, behavior that is different, such as exhibiting signs of being withdrawn, any bruising, a change in appearance, the child appearing disheveled or unkempt, significant weight loss, indication that the child is hungry or not getting adequate food. Allied healthcare professionals or play therapists should objectively and thoroughly document in the patient's medical record, providing a description of direct observations. When able, use the patient's own words if something's disclosed. If you report alleged abuse, neglect, or issues that place the patient at risk, document this in the record. Know how to contact your child abuse and neglect hotline before you should need to do so. Also, be aware of local resources such as food banks, shelters, or other community resources, and when indicated, provide this to the child's parent or guardian. I want to talk a little bit about telehealth. If reopening, consider telehealth when possible. If your state allows play therapists and allied healthcare professionals, such as social workers, family therapists, and counselors to engage in telehealth, the service is compatible with telehealth, and the patient has access to a device to engage in telehealth, this should be a consideration. The APT website has a number of helpful links that I encourage you to review. Many states have relaxed regulations concerning telehealth. It's important to stay up to date on regulations, as they may change when the emergency orders are lifted. There are times when telehealth may not be possible depending on the type of service. However, when able, consider the use of telehealth versus in-person services. If engaging in telehealth, it's important to be aware of risks associated with technology. During this time, video teleconferencing or VTC platforms have surged. Many states implemented emergency orders improving access to telehealth, while at the same time, federal regulations under HIPAA have also been relaxed. New risks have emerged due to this increased use of the platforms. TRMS has a resource on the TRMS website that discusses this in more detail, but I want to mention one emerging risk in particular. It's referred to as Zoom bombing, a new form of harassment in which hackers intercept video calls and post hate speech and offensive images, including pornography. This has occurred in multiple locations, both domestically and internationally, including 2 Massachusetts-based schools, a San Diego, California high school, during a doctoral dissertation at the California State University Long Beach, and incidents that have prompted the New York City Department of Education and schools in Singapore to stop using the platform. These incidents reportedly occurred specifically while using the Zoom platform. The FBI issued a warning for users to engage in certain practices to reduce the risk of being hacked. As time is limited today, I want to encourage you to check out the TRMS resource section on the TRMS website that provides the information on the FBI warning and how to minimize risk. No matter which VTC platform you use, it is important to exercise due diligence in selecting a secure platform. Additionally, it is critical to have security systems in place to minimize security breaches. Finally, be up to date on applicable telehealth rules as they change. Here is the FBI warning regarding Zoom bombing. Again, please check out the TRMS resource section on the TRMS website that provides additional information and how to reduce risk. Third-party considerations. Should you have vendors or delivery persons, ensure that they are adhering to relevant recommendations for social distancing and wearing protective equipment. Maintain open communication with those coming in and out of your office. Review your contracts. You may have existing contracts with vendors. Your practice may change considerably and cash flow may diminish. It's important to review your existing contracts and determine if you need to renegotiate. Let's talk a bit about informed consent. Lawsuits related to the pandemic are already emerging. Consider an addendum to your informed consent document that indicates the risk of transmission still remains and that the patient is choosing to accept the risk of contracting COVID-19. Consult with your legal advisor when considering an addendum to your informed consent document. Also, the TRMS website has several sample informed consent documents, which I encourage you to take a look at. As a play therapist, you likely treat minors. As you reopen, if you're amending your informed consent document or other documents, consent should be obtained from the person who is legally responsible for the minor. If the minor is of such an age and maturity that he or she would understand the proposed treatment and the risks and benefits of the proposed treatment, you should consider also discussing these issues with the minor as well as the parent or guardian. Involving the minor patient in the treatment decision process is critical in forming a reliance with the patient and allows him or her to express his or her wishes despite having the legal inability to choose. If you have, for example, a grandmother who brings in a minor patient to be seen, but she may not have the legal authority to complete paperwork related to treatment, or you may have a minor whose parents are divorced and one parent has the authority, but the other does not. Ensure that you obtain paperwork prior to initiating treatment. You may also have a situation where there's a joint decision-making process where one parent agrees and the other does not. Ask for a copy of any court documents concerning decision-making or consent to treatment. When you have a tricky situation, it's always best to get advice before beginning treatment. Unless you have an emergency, it's always best to have the necessary documentation before beginning treatment. Conclusion. There are many considerations when reopening. This is all new and uncharted territory. Make sure that you stay connected and are informed. Regulations and guidelines are changing all the time. They're literally changing on a daily basis. Remain knowledgeable and up to date on applicable regulations pertinent to your practice. Be aware of guidance from the APT, the CDC, and the federal and state regulations and guidelines. Consult with colleagues and seek advice should you have questions. Discuss your concerns, ask for guidance, and do not feel pressured to do something that could put you, your patients, and your family at risk. Seek professional guidance. If you have questions, seek guidance from your local attorney or risk management professional. Thank you for your time today. For more information on this topic, check out our online resources. If you have any questions about our products, please contact us at the following number or email. Thank you again, be well, and I hope that you enjoyed this program today.